What if I told you that everything you've been taught about masturbation after 60 is not only wrong, but actually dangerous for your health? Most men have never been told the real reason why their sexual function changes so dramatically after this age, and it has nothing to do with what you think. I'm Dr. Eva Hart, and I've spent the last 14 years specializing in men's health after 60. In my practice, I've helped thousands of men reclaim their sexual vitality naturally without pills or invasive procedures. What I'm about to share with you today will challenge everything you believe you know about male sexuality in your golden years. Here's what no one talks about. The shame surrounding this topic is literally killing men's confidence and destroying their relationships. I've sat across from countless men, successful businessmen, fathers, grandfathers, who whisper their concerns as if they're confessing sins. But here's the truth: this isn't your fault. Your body is simply responding to changes that every man experiences, but that doesn't mean you're powerless. This is one of those topics that makes everyone uncomfortable. Society tells us that men over 60 should just accept declining function, that it's natural aging. But I'm here to tell you that's complete nonsense. The silence around this subject has created more damage than the physical changes themselves. In this video, I'm going to reveal 6 secrets that most urologists never share with their patients. Simple, natural techniques that can restore function, increase satisfaction, and give you back the confidence you thought was gone forever. These aren't theories, they're proven methods I've used with real patients who are now living proof that age is just a number. This is about more than just physical performance. It's about reclaiming your identity as a man, your confidence in intimate relationships, and your overall quality of life. When you understand how your body actually works at this stage of life, everything changes. Stay with me until the end, because I'm going to share one technique that my patients call the game changer, something so simple yet so effective that men wish they'd known about it decades earlier. And if this topic resonates with you, share in the comments what exactly speaks to you. And if it doesn't, let me know how I can improve the content and what topic would be more interesting for you. But first, let me tell you about something that's happening to your testosterone levels right now that your doctor probably never explained. Secret number 1: the frequency myth that's destroying your confidence. Let me tell you about something that's quietly happening to most men over 60, and it's not what you think. For decades, you've probably heard that less is more as you age, that you should reduce frequency to preserve your energy. This is one of the most harmful myths in men's health, and it's based on outdated thinking from the 1950s. Here's what actually happens. Your body operates on a use it or lose it principle. When you reduce sexual activity, whether with a partner or alone, you're actually training your body to shut down those pathways. Think of it like a muscle that gets weaker when you don't exercise it. Your blood flow decreases, nerve sensitivity diminishes, and hormone production drops even further. I remember one patient, Thomas, 68, a retired teacher who came to me devastated. He'd been following his doctor's advice to take it easy for 3 years. When he finally tried to be intimate with his wife on their anniversary, nothing happened. He told me, "Dr. Hart, I felt like I wasn't a man anymore." What Thomas didn't know, and what most men don't realize, is that regular sexual activity, including masturbation, actually supports healthy hormone production, improves circulation, and maintains nerve function. It's like keeping your engine running smoothly instead of letting it sit in the garage. The natural solution isn't complicated. Consistency matters more than intensity. Research shows that men who maintain regular sexual activity throughout their 60s and beyond have better overall sexual function, higher testosterone levels, and improved cardiovascular health. Within 6 months of adjusting his approach, Thomas experienced a complete transformation. Not just physically, but emotionally. He told me, "I feel like myself again, like the man my wife married." His confidence returned, and with it, his relationship improved dramatically. But here's something even more important that most men get completely wrong about timing. Secret number 2: the timing secret that changes everything. I've noticed something troubling in my years of practice, and it's about when men think they should be most sexually active. Countless men tell me the same thing. "I used to be ready anytime, now I need everything to be perfect." This mindset is actually working against your natural biology. Here's what most doctors won't tell you. Your hormone levels fluctuate throughout the day in predictable patterns, even after 60. Your testosterone is typically highest in the morning, sometimes 25 to 40% higher than evening levels. Yet most men try to force intimacy at night when their hormones are at their lowest ebb. Your body is giving you signals, but you're not listening to them. That morning arousal you occasionally experience? That's not random, that's your body telling you when it's most capable and ready. But instead of working with this natural rhythm, most men ignore it because they think morning intimacy is somehow inappropriate or inconvenient. One of my patients discovered this completely by accident. He was experiencing almost no function for months, feeling defeated and avoiding all intimacy. Then one Saturday morning, his wife initiated and he was amazed by his response. When we discussed his hormonal patterns, everything clicked. The science is clear. Morning testosterone levels can be significantly higher, blood flow is often improved after a night's rest, and stress hormones like cortisol haven't yet peaked from daily pressures. You're literally working with your body instead of against it. This isn't about changing your relationship dynamic or pressuring anyone. It's about understanding when your body is naturally most responsive and being open to those moments. Sometimes the simplest adjustments create the biggest changes. If you're reading this and it resonates with you, type plus in the comments. It's important for me to know that this information is helping you. What I'm about to share next completely destroys a dangerous belief that's keeping men trapped in cycles of anxiety and failure. Secret number 3, the pressure myth that's making everything worse. Here's what most doctors won't tell you about performance pressure after 60. The fear of failure is often more damaging than any physical changes happening in your body. I've seen men with perfectly healthy circulation and hormone levels who can't function simply because they're terrified of disappointing their partner or themselves. This creates a vicious cycle. You worry about performance, which increases stress hormones, which actually impairs function, which confirms your fears, which increases anxiety even more. It's like being afraid of forgetting someone's name so much that you actually can't remember it. Let me share something about one of my patients, a successful businessman who ran companies but couldn't relax in his own bedroom. He'd built up so much pressure around performing that he was literally sabotaging himself before he even tried. His wife wasn't demanding performance, he was. Here's the medical reality. Chronic stress and performance anxiety actually change your brain chemistry. They increase cortisol, which suppresses testosterone, and activate your sympathetic nervous system, which reduces blood flow to exactly where you need it most. You're chemically working against yourself. The natural approach isn't about techniques or tricks, it's about changing your relationship with the experience itself. Instead of focusing on an outcome, focus on sensation, connection, and pleasure without destination. Think of it like meditation. The moment you start judging the experience, you're no longer present for it. When this patient learned to approach intimacy as exploration rather than examination, everything shifted. Not just his function, but his confidence, his relationship with his wife, and his overall stress levels. He said, "I remembered why I used to enjoy this in the first place." This mindset change isn't just psychological, it has real physiological effects. Lower stress means better hormone balance, improved circulation, and enhanced nerve sensitivity. You're literally creating better conditions for success by removing the pressure to succeed. But there's one physical factor that most men completely overlook, and it might be the most important thing I tell you today. Secret number 4. The circulation secret hiding in plain sight. Here's something that quietly destroys masculinity after 60, and it's happening right now while you're watching this video. You're probably sitting down, and you've probably been sitting for hours today. What you don't realize is that prolonged sitting is one of the biggest enemies of healthy sexual function, especially as you age. Think about this. Healthy sexual function requires optimal blood flow. But modern life has us sitting at desks, in cars, on couches for 8 to 12 hours daily. This constant compression reduces circulation to your pelvic region, weakens the muscles that support sexual function, and creates inflammation that interferes with nerve sensitivity. I had a patient, a retired accountant, who was convinced his problems were just aging. But when we looked at his daily routine, he spent 14 to 16 hours sitting: breakfast, computer work, lunch, television, dinner, more television. His body was essentially shutting down blood flow to the areas that needed it most. Here's what's really happening. When you sit, you compress major blood vessels, reduce muscle activation in your core and pelvic floor, and create chronic tension patterns that persist even when you stand up. Over months and years, this literally reshapes how your body moves blood and maintains muscle tone. The solution is surprisingly simple but requires consistency. Every 30 to 45 minutes, you need to move. Not just stand, actually move. Walk around your house, do some stretches, engage your core muscles. Think of it as maintenance for your circulatory system. Additionally, specific exercises can dramatically improve pelvic blood flow. Simple movements like squats, bridges, and even walking can restore circulation patterns that have been compromised by years of sitting. Within 8 weeks of changing his movement patterns, my patient noticed significant improvements. Not just in sexual function, but in energy, sleep quality, and overall vitality. Movement medicine is real medicine. Now, let me tell you about the one factor that ties all of these secrets together. Secret number 5, the hydration factor no one talks about. I've noticed a disturbing pattern among my patients over 60, and it's so obvious that it's often overlooked completely. Most men at this age are chronically dehydrated, and they don't even realize it. What they don't understand is that proper hydration isn't just about avoiding thirst, it's absolutely critical for healthy sexual function. Here's the connection most men never make. Sexual arousal depends on blood volume and circulation. When you're dehydrated, your blood becomes thicker, your heart has to work harder, and circulation to extremities, including sexual organs, decreases significantly. You're essentially trying to function with compromised plumbing. But there's more to this than just drinking water. As men age, their thirst sensation diminishes, kidney function changes, and many medications actually increase dehydration. Plus, many men deliberately limit fluids because they're concerned about nighttime bathroom trips. One of my patients figured this out completely by accident. He'd been struggling with function for over a year when he got a mild stomach bug and had to drink large amounts of water and electrolytes to recover. During his recovery week, he noticed his morning function was better than it had been in months. The science supports this observation. Proper hydration improves blood volume, supports healthy blood pressure, enhances nutrient delivery to tissues, and even affects hormone production. You're literally giving your body the raw materials it needs to function properly. The solution isn't just drinking more water, it's about strategic hydration. Most of your fluid intake should happen earlier in the day, include natural electrolytes, and be consistent rather than sporadic. Think of it like watering a plant. Little and often works better than flooding occasionally. This patient made hydration a priority and noticed improvements within 2 weeks. Better energy, clearer thinking, improved sleep, and yes, better sexual function. He said, "I never realized something so simple could make such a difference." If you're reading this and it resonates with you, type plus in the comments. It's important for me to know that this information is helping you. But there's one more secret that most men never discover until it's almost too late. Secret number 6, the sleep connection that changes everything. Here's something most men have never been told about the relationship between sleep and sexual function after 60, and it's probably the most overlooked factor in my entire practice. Poor sleep isn't just making you tired, it's systematically destroying your masculine vitality in ways you never imagined. Most men tell me they sleep fine because they fall asleep easily or stay in bed for 7 to 8 hours. But what they don't realize is that sleep quality changes dramatically after 60, and this directly impacts hormone production, circulation, and nerve function. Here's what's happening while you think you're sleeping well. Your testosterone production occurs primarily during deep sleep phases. If you're not reaching or maintaining these phases due to sleep apnea, frequent waking, or poor sleep environment, your body literally can't produce adequate hormones. I had a patient, Robert, 65, who was convinced his problems were purely physical. His blood work looked reasonable, His circulation seemed adequate, but his function was almost non-existent. Then his wife mentioned that he snored heavily and seemed to stop breathing periodically during the night. When we did a sleep study, we discovered he was waking up briefly over 40 times per hour. Connection between sleep and sexual function isn't just about hormones. Poor sleep increases inflammation, elevates stress hormones, impairs circulation, and disrupts the nervous system's ability to respond properly to stimulation. The natural approach starts with sleep hygiene, but it goes deeper. Your sleep environment, breathing patterns, and even your position in bed can dramatically impact sleep quality. Simple changes like elevating your head slightly, using a humidifier, or addressing snoring can restore the deep sleep phases your body needs. After addressing his sleep apnea with natural methods, weight loss, sleeping position changes, and breathing exercises, Robert experienced improvements within a month. Not just in function, but in energy, mood, and overall vitality. He said, "I feel like I've been half asleep for years and finally woke up. Now let me show you how all of these secrets work together to create the transformation you're looking for. Let me bring all of this together for you. The frequency myth, timing awareness, pressure release, circulation improvement, proper hydration, and sleep optimization, these aren't separate issues. They're all connected parts of a system that either works for you or against you. Here's what I want you to understand. Your masculinity isn't something you lose gradually with age. It's something that gets suppressed by lifestyle factors that can be changed. Every man I've worked with who implements these natural approaches sees improvements, not because they're special, but because they're working with their body instead of against it. The most important thing to remember is this: your body wants to function properly. It's designed to maintain sexual health throughout your life. When it's not working, it's usually because something is interfering with natural processes, not because those processes have permanently shut down. I've seen 75-year-old men experience dramatic improvements in function, confidence, and relationship satisfaction by making these simple adjustments. It's not about turning back time, it's about optimizing what you have right now. Your masculinity can be restored naturally. You don't need dangerous pills, expensive procedures, or complicated protocols. You need to understand how your body works at this stage of life and give it what it needs to thrive. Start with one change. Maybe it's timing, maybe it's movement, maybe it's hydration, or perhaps it's addressing your sleep quality. Pick the one that resonated most with you today and commit to it for 2 weeks. Notice what happens. Then add another change. Remember, this journey isn't about perfection, it's about progress. Every small improvement builds confidence, and confidence creates more improvement. You're not broken, you're not too old, and it's definitely not too late. The men who see the best results are those who understand that these changes work synergistically. Better sleep improves hormone production, which enhances circulation, which supports better function, which reduces anxiety, which improves sleep quality. If you found value in today's video, please subscribe for more evidence-based advice on men's health after 60. Hit the notification bell so you don't miss future content that could change your life. In the comments, let me know which of these 6 secrets surprised you most, or share what topic you'd like me to cover next. Your questions and experiences help me create content that truly serves this community. And please share this video with any man in your life who might benefit from this information. Sometimes the most powerful thing we can do is let other men know they're not alone in this struggle. Your best years aren't behind you, they're ahead of you. And they start with understanding that your body is still capable of amazing things when you give it what it needs. Take care of yourself, and I'll see you in the next video.